Stroke versus TIA. What's the difference?
Make sure to save this video. Let's start with stroke. What is stroke? Is when the blood flow to the brain is impaired or blocked. Symptoms of stroke can include whether it be from a clot or from hemorrhage. And this brings us to two types of stroke, ischemic and hemorrhagic. Can you tell which one is more common? If you guess ischemic, you're right. Ischemic stroke can be a thrombotic or embolic event. In a thrombotic event, the thrombus, aka clot, is actually within the vessel itself. An embolic event is when the clot is formed somewhere else in the body and it travels through the bloodstream to the brain and impairs blood flow. Hemorrhagic stroke is when a blood vessel ruptures in the brain. There's actually two types, intracerebral and subarachnoid hemorrhage. And that's the difference between the two. And can you guess the most common cause? Hypertension. Finally, what is a TIA? The answer is in the name, transient ischemic attack. It's when the blood supply to the brain is cut off, but briefly. The symptoms are similar to stroke and they occur suddenly, but symptoms usually resolve within an hour. It should be considered a warning sign that an impeding ischemic stroke can occur, and the risk is higher within the first 48 hours after a TIA. In part 2, we'll talk about recognizing